when it comes to MTP, which is medical termination of pregnancy or induced abortion. So this is intentional or voluntary termination of pregnancy before the full term. Okay, now you see a few points with regards to MTP. First, you need to know what is the definition of this induced abortion. Now, MTP, no doubt, it's voluntary termination of pregnancy. It has a role in decreasing the population. Okay, it has a role in decreasing the population, but it is not meant for this purpose. Okay, now why is it meant for? What is this medical termination of pregnancy? Whether to accept or to legalize MTP or not is being debated in various countries. Okay, but Government of India legalized MTP in 1971, but with very strict conditions to avoid its misuse. Okay, so Government of India legalized MTP 1971 with some strict conditions. It is mainly meant for preventing unnatural maternal death due to unsafe abortion. And the act has been amended again in 2002. Now, according to this amendment, okay, which was made in 2002, under this act, termination of pregnancy can be done up to 20 weeks if pregnancy is likely to produce a congenitally malformed child or is a result of rape or contraceptive failure or is likely to harm the mother. Are you understanding? So basically, Government of India legalized it, but it was again amended in 2002. Now, under this act of termination of pregnancy, it can be done up to 20 weeks if the pregnancy is likely to produce a congenitally malformed child. Congenital is some disorder at birth, okay, or is a result of rape or contraceptive failure or is likely to harm the mother. Only under these conditions, okay, termination of pregnancy can be performed. So misoprostol, which is a prostaglandin, okay, because prostaglandins along with mifepristone, which is anti-progesterone. Now, anti-progesterone is given because progesterone will help in maintenance of the endometrium, correct? So anti-progesterone is given, or prostaglandins, which will cause myometrial contractions. So this is an effective combination for MTP. Later, vacuum aspiration or surgical procedures can be adopted. Okay, so I told you obviously why MTP, okay? No. MTPs are relatively safe during the first trimester, which is up to 12 weeks of pregnancy. They are relatively safe. Second trimester abortions could be more riskier. Now, another dangerous trend is the misuse of amniocentesis or sonography. Now, I'll explain you what is this amniocentesis. Okay. Now, in amniocentesis, this is a technique wherein I hope you all know about the amniotic fluid, correct? The amniotic fluid, which is present in the amniotic sac. Okay, so in the amniotic fluid, which is in the amniotic sac, there are certain cells, okay, and these cells basically are taken out, okay, and from the cells, a karyotype is done. A karyotyping is done. Now, what is karyotyping? This is nothing but it's arrangement of all the chromosomes. So you basically tend to arrange, okay, this is arrangement of chromosomes. Now, if let's say, you've arranged all the chromosomes, let's say this is chromosome 1, let's say this is chromosome 2, this is the chromosome 3, the homologous chromosome, okay, pair of it. Now, based on karyotyping, what you can do is you can know about you can know about chromosome numbers, isn't it? Now, for example, and you can also know if there is an X and Y, okay, chromosome, where that means you can know the sex of a child. But keep in mind, amniocentesis is not done to know the sex of a child. To know the sex of a child is illegal, correct, in India. But otherwise, what can you do with amniocentesis? You can know, okay, And then of course, you can know if there is any kind of chromosomal disorders present, correct? With regards to its number. You can also know the sex of a child, but knowing the sex of the child is illegal, as I said. Okay. So if the fetus is found to be female, usually if the fetus is found to be female, it is followed by MTP, okay, which is which is totally illegal. So in amniocentesis, what is done is the cells from the amniotic fluid, okay, from there a karyotyping is done. That means you're doing an arrangement of the chromosomes. So you can know the chromosome number, if there's any chromosome missing, okay. But you cannot determine gene mutations from here. We are not doing gene sequencing. We're just knowing about the chromosome. The chromosome number, shape. You can also, if there's some segment of the chromosome missing, okay. But then you cannot, for example, Klinefelters. Okay, you can if the I mean if there is any kind of disorders with regards to chromosome number, right? The Klinefelters can be detected, but you will not be able to detect a sickle cell anemia. You cannot know gene mutations from these studies. Okay, so this is one of the important questions which have been asked for NEET a number of times. Okay, with regards to amniocentesis. And also, you can know the sex of a child, but that's illegal. Keep in mind. Okay. So if MTP is followed just by knowing the sex of a child, okay, then it's totally illegal. Okay. Now, the next point, the Medical Termination of Pregnancy Amendment Act 2017. This was enacted by the government of India with the intention of reducing the incidence of illegal abortion and consequent maternal mortality and morbidity. This is again very important. So Amendment Act 2017 was enacted only with the intention of reducing the incidence of illegal abortion. Okay. And consequently maternal mortality and morbidity. See, according to this act, according to the Amendment Act 2017, according to this act, pregnancy can be terminated on certain grounds, which is within the first 12 weeks of pregnancy, within the first 12 weeks of pregnancy on the opinion of one registered medical practitioner. If the pregnancy has lasted more than 12 weeks but less than 24 weeks, then two registered practitioners must give their opinion. And what are the grounds for such termination? Okay, what are the grounds for such termination of pregnancy? It is if the continuation of the pregnancy would risk the life of the pregnant woman, or if grave injury, which is physical or mental health. Okay, now it depends if it risks the physical or mental health of the lady. Or if there is a risk that the child were born would suffer from physical and mental abnormalities. Okay, so we start with STD, which is sexually transmitted diseases or venereal diseases, VD, or reproductive tract infections, RTI. Okay, now if you look at all these diseases here, gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, can you see all the causative organum and the diseases here? Gonorrhea, syphilis, genital herpes, genital warts, trichomoniasis, chlamydiasis, hepatitis B to be very specific, okay, which is caused by hepatitis B virus, HIV infection, AIDS is caused by HIV, human immunodeficiency virus. Cancroid is caused by Haemophilus ducreyi. Now, what could be asked here is basically the causative organism. Now, gonorrhea is caused by a bacteria, syphilis by a bacteria, herpes by a virus. Can you see? Trichomoniasis is by a protozoan parasite. So, all these questions you could get. Okay. Make a note of it. Okay. Now, next, look at this. Amongst these, HIV infection is most dangerous. Infections like hepatitis B and HIV can also be transmitted by sharing of injections, needles, surgical instruments with infected persons, transfusion of blood, or infected mother to the fetus too. Except for hepatitis B, genital herpes, and HIV infections, other diseases are completely curable. So, except for hepatitis B, genital herpes, and HIV, that means these three are not completely curable. Okay, others are completely curable if detected and treated properly. Very important for NEET, this part. Symptoms, okay? Symptoms, itching, fluid discharge, slight pain, swelling in the genital regions. So these are all the symptoms. Infected females may be asymptomatic and can remain undetected. Okay. Now, if not treated properly, then later there could be complications. And the complications could be pelvic inflammatory disease, PID, abortions, stillbirth, ectopic pregnancy. What is this ectopic pregnancy? Other than its usual place. Okay. Now, for example, I told you in the last case that instead of the uterus, the entire blastocyst may go and get implanted in the fallopian tube. So that is ectopic pregnancy. Okay. Anywhere other than the uterus, if implantation takes place. That's ectopic. And there could be infertility or even cancer of the reproductive tract if complications. Okay. That's the reason why the RCH program. Okay, so usually people in this age group between 15 to 24, because of the lack of information, are vulnerable to these infections. Okay, this age group. So simple principles are given here, to at least prevent these infections. Avoid sex with unknown partners or multiple partners. Use of condoms during coitus, and of course, early detection and get complete treatment if diagnosed.